United States recording its first measles death in a decade. This is First Alert 4 at 6. I'm Corey Stark.
I'm Samantha Jones. As the outbreak worsens, fears heighten for parents in our area. An unvaccinated child died from measles in Lubbock, Texas. And now the highly contagious disease is spreading to New Mexico. Russell Kinsall diving into the dangers and what else you need to know as that outbreak spreads, Russell.
Well, there is a renewed focus on the measles vaccination rates, and they're alarmingly low for the city of St. Louis. Parents can protect their children by getting them vaccinated, but there is a little-known group of adults born in the 1960s who were vaccinated but could be walking around with no immunity to the measles. Warm weather brought moms and kids to this Chesterfield playground. One of the kids is 3-year-old Giancarlo Caluros.
He's a wild little boy. We spend most of our time in the woods on trails.
One of the ways that Gianna Caluros protects her son is to make sure he's vaccinated for the measles and other diseases.
We have the blessing and the benefit and the privilege of having modern medicine available to us.
Dr. Rachel Orslin is a WashU pediatric infectious disease physician at St. Louis Children's Hospital.
Vaccination is safe and effective and can prevent measles, which in some cases, as we've learned recently with the pediatric death in Texas, can be a severe illness.
Across the country, state vaccination rates for the measles has fallen 10 to 35% since the COVID pandemic. Here are the latest local measles, mumps, and rubella, or MMR, vaccination rates. In St. Louis City, it's an alarming 75%. St. Louis County, 92%. St. Charles County has a 95% rate. Jefferson County, 93%. And Franklin County, 89%. The overall vaccination rate for Missouri is around 90%.
Unfortunately, that's not high enough to prevent children becoming ill and also outbreaks from occurring. So we do need to see an increase in vaccination rates among our school children.
Besides young children, there's a group of adults born between 1963 and 1967 who are vulnerable to the measles. The vaccine they received as children was ineffective.
I've never heard of anything like that.
They need to have it done.
There is a time period where people were vaccinated with an inactivated vaccine and they may not be fully protected. So if people have concerns about their vaccination status, it's really important for them to talk with their healthcare provider.
So anyone exposed to the measles who is not vaccinated has a 90% chance of catching it. If you've ever had it, you have a lifelong immunity. And keep in mind, the vaccine is widely available. Live in the newsroom, Russell Kinsall, First Alert 4.
Good information, Russell. Thank you.